for visual acuity improvement in patients with highly irregular corneas. So this is mostly advanced keratoconus, post-graft patients, corneal scars, where we cannot fit standard contact lenses. There are sporadic cases, and for these other indications, it's also in some centers in the world it's more often used because they are more connected with large clinical hospitals. So they have also very good experience. We have a few patients with such experience. So ocular surface disease, dry eye, etc. We will see the indications later. This is how it looks. So we have also the option to choose the designs that is manufactured in our lab, and it makes this a lot easier. We don't fit still entirely empirically just based on it. Hopefully we will, but at the moment we like to check the suggestions it gives us. We like to check it with the test lenses. So this is one of the patients from last week. Advanced keratoconus. Maybe you can see how the stroma and the scar has thinned. The stroma is very thin, so the epithelium has overgrown. So this was one good case. It's a young patient, 22 years, where there was a very good improvement in visual acuity from best spectacle corrected visual acuity to this visual acuity. This is also our long-time patient from our Dr. Carmen, who fits most of our scleral lenses. And this is a patient where there was not such a successful penetrative keratoplasty done in one neighboring country. And we also managed to vault this part of transplant and limbus and achieve a very solid visual acuity. So basically, the indications for scleral contact lenses is when conventional surgical methods cannot restore visual acuity or achieve comfort. Dadi Fadel is one of, at the moment, very authors that publish a lot and do a lot of work in education. She was also in Croatia recently. She named 62 indications she found in the literature. So in the first group are the irregular cornea, so patients where we can get better visual acuity, like corneal scars, but also there are other indications like South-Frontier marginal degeneration, and especially some types of ocular surface disease, not just typical dry eye. Some, like Professor Severinsky from memory, I think, he showed his very good results in these few cases of neurotropic keratopathy, ocular sacrificial pemphigoid, and graft versus host disease patients. It's very difficult to solve these cases, so these patients are very happy when they achieve basically good comfort, not just vision. We must be careful with in patients with low endothelial cell density and like Fuchs endothelial dystrophy. Also in patients in glaucoma, it's not, the jury is still out, some papers say that we must be careful because it can reduce the outflow of the aqueous humor, so we must be careful and follow these patients. And of course, overnight wear only exceptionally when we need it in some indications. As a conclusion, profilometry so far can accurately assess the shape of scleral cornea, reduce chair time, and hopefully one day we will also see a fully automated process of fitting, which now takes a long time. Thank you.